All right, so this is the traction splint. In the National Registry skill sheet, it's going to be called the immobilization of long bone immobilization, right? Now, I have a special instruction sheet in your skill sheets to go over the traction splint itself. It's much different than the National Registry skill sheet. This is used, and you'll have to remember that it's going to be used for mid-shaft, mid-shaft femur fracture, right in the middle only, mid-shaft femur fracture, and it's an isolated mid-shaft femur fracture. It's not only an isolated, it's an isolated closed mid-shaft femur fracture. So it's not affecting anything else, and that's the only thing that the patient is really complaining about. Because if there's anything else that the patient is complaining about, this takes too long, and we might want to do more of a rapid extrication, and therefore we would anatomically splint the leg and move on. Okay. So the traction splint is used so that once it's full extended and the ankle harness is placed on, it'll pull and draw. It'll pull and draw this harness and straighten the leg out. Now, the thigh muscle is the largest muscle of the body, pretty much, can withstand squats of hundreds of pounds. So this is not going to realign the bone after it's broken. See, midline, isolated mid-shaft femur fracture, closed mid-shaft femur fracture. It's not going to pull the bone back, but it's going to stabilize it from moving. And that's what we want. Because what happens if you don't stabilize that mid-shaft femur fracture, that closed, isolated mid-shaft femur fracture, when the muscle, that large muscle, starts to pull, it'll jar back and forth. And imagine these things are knives, because the broken bones or shards start charging into the muscle and causes the muscles to contract, and so we get more of this tension. You can imagine the amount of pain the patient's in. All right. So anyhow, I want you to familiarize yourself. This will go under the ischium, underneath the buttocks. This is the pad for that. There's a strap that goes through the groin, the ischial strap. We have 4 straps that go over the area, 2 above, and then 2 below. We never put it on the fracture site, never put it over a joint. And then we have this mechanical traction that draws up this ankle harness. The ankle harness, there are many different types. We'll show different ones in class, but for now, this is the one that came in the bag. It goes underneath the ankle, and it wraps over the heel, so that we can then attach the mechanical traction to crank it back down, which will pull traction on the leg, and that's why it's called a traction splint.